Namaste and welcome to the next lecture of Clinical Ayurved. In last lecture, I told you that I have shifted to a different track in our lecture series and reason behind that also. And so we are discussing clinical application of a drug and we have started with the Guruchi. So I said you that when you are learning a drug clinically, first you have to derive the information in the text and just see the Rasavirya Panchak, Rasavirya Guna of that drug, and on this logic, on this basis, now we will discuss the each karma of the dravya. In that, the first karma in the shlok was Guruchi Katuga Steta Satupaka Rasayani, and I have just briefly told you that how Guruchi works as a Rasayan. Today we will discuss the other angles of this Rasayan karma of the Guruji. I had told you that in our first lecture of Rasayan karma that Rasayan karma, to happen Rasayan karma in the body, the 6 stages are required. First, Dhatu Poshak Ansha should be given, a Dhatu Poshak condition. Then Dhatu Dhatu need to digest and perform a good aharas. That aharas to be taken to the srotas by Vayu. We should be Anulom for that, and for Anulom Vayu there should not be any Sotorod. So absence of Sotorod and Prakrut Anulom Vayu is the next condition by which that aharas reaches to the Dhatu. Then at Dhatu Srotas of each Dhatu performs and the Prakrut Dhatu, Uttam Dhatu is formed. But after that also one important thing, Malapachan, Shoshan, Utsarjan, which is Mala which is formed at the Jathani level as well as Dhatani level should be exceeded from the body, otherwise that accumulation will hamper Rasayan karma in future. So all these 6 steps are required for Rasayan karma, and when Guruji is told as a Rasayan, now we will discuss in detail on the Rasaviryapak of Guruji and all these conditions and the linking between them. The first is Dhatu Poshak Ansha. Now, if we see that Rasaviryapak, among these Tirthakatu Kashaya, Madhurvipak, Ushnavirya, Lavruksha Guna, only Madhurvipak is the factor which is having Dhatu Poshak Karma. You know, Madhurvipak is Dhatu Poshak. So, the first condition of Rasayan is that body should be having enough Dhatu Poshak Ansha, and that condition will be fulfilled by Madhurvipak of the Guruji. So, logically, what generally we people say that Guruji performs Rasayan karma by its Madhurvipak and by nourishing Dhatus. Right. 100% right. My question is, when Madhurvipak is performing Dhatu Poshan karma, at the same time, other factors, Tirthakatu Kashayaras, Ushnavirya, Laghuruksha Guna, have totally different action. Other factors except Madhurvipak are not indicated for Dhatu Poshan. Actually, these all other factors are Dhatukshayakara. There is no any system that when you are giving Guru Churna to the patient and you can't say only Madhurvipak will work and other factors will not perform their karma in the when they are the drug is introduced in the body. Remember, if Madhurvipak is performing the function, at the same time other factors which have Dhatukshaya action will also perform. So when you are going to use Madhurvipak for the Guruji, then and if you want that Madhurvipak to act, then you have to balance the other factors which are not wanted at that for that particular function. What it means that if you don't balance तित्तकटू कषाय रस उष्णवीर्य लघुवृक्ष गुण of the guduchi, then the 100% action of madhuripak will not be seen, because other factors and madhuripak has totally different action. Always remember. So what is the solution for that? The solution is you have to balance rasa, you have to balance ushnavirya, and you have to balance laghuruksha guna. Then only madhuripak will perform 100%. And the solution is first dravya sanyog, second yogya anupan, and third is yogya kalpana of guduchi. So if I want to enhance this madhuripak karma and balance it, I can mix the guduchi with the drugs like yashti madhu, which will have madhur ras. Madhuripak will enhance madhuripak karma of guduchi. Shita virya laghu guru siddha guna, or I will give anupan like ghruta or dugdha, which are madhurasatmak. Madhuripak will enhance the madhuripak function of guduchi. Shita virya, guru guna, and siddha guna. I will give dugdha or ghruta as anupan, or I will give guduchi siddha ghruta or guduchi siddha dugdha, which will enhance the property of madhuripak in multiple way. So unless and until I don't balance these unwanted properties of guduchi, my guduchi will not perform rasayan karma by its madhuripak, and dhatu poshan will not happen. I am giving stress on this by 2 or 3 times again and again, because always remember, when you are using a drug, especially vichitra pratyartha dravya, which having totally different properties like guduchi, then you have to think of the wanted, you have to enhance the property of the wanted factor like madhuripak in guduchi in this dhatu poshan karma, and at the same time you have to balance the unwanted properties by sanyog, by kalpana or anupan. So always remember that unless and until the balancing of these factors is not done, dhatu poshan karma of guduchi by madhuripak will not happen. And this fact always keep in mind when you are using drug in practice. You have to think of the unwanted properties, and you to enhance the property which you want to perform in the body. I am going very slow and steadily for this guduchi dravya, because I want to set an ideal specimen for you. By learning that, you can understand and you will be able to evaluate the other drugs which you use in the practice. So let us conclude today by this only one karma of guduchi as dhatu poshan by madhuripak. We will discuss other karma of or other factors of rasayan and other karma of guduchi from the next lecture. Thank you very much.